Hi everyone, my name is Alex. I'm a first year medical resident at Loyola University Medical Center, and for my entry into this year's liver health poster competition, I wanted to focus on one of the most exciting advances in the treatment of cholangiocarcinoma, which is liver transplant. Briefly, cholangiocarcinoma itself is a cancer of the bile duct system. These are ducts that sort of snake throughout the liver and then form one large bile duct. They help take toxins and waste and other things that are processed in the liver and drain them into the GI tract where they can then be excreted from the body. Cholangiocarcinoma is classified where it occurs in this bile duct system. It actually comes out of the cells of the bile ducts. And if it comes out of a duct in the liver itself, it's known as intrahepatic. If it comes out of one of the bile ducts in that middle area where the bile ducts are sort of collecting together and exiting the liver, it's called perihilar. And if it occurs in the common bile duct, the large duct draining out of the liver, it's called distal. This is important because the role of liver transplant and how we treat cholangiocarcinoma in general is in part determined by the location where it occurs. Previously, cholangiocarcinoma could only be treated with surgery, trying to resect the tumor, and these were sort of very large, complicated, dangerous surgeries. Many patients weren't candidates, and many patients who had these surgeries had all sorts of postoperative complications that were also dangerous. Liver transplant is sort of exciting because we can take out the whole system at once and then try to transplant a healthy liver without this cancer that will help patients live longer, healthier, ideally normal lives. Liver transplant has sort of only been studied in cholangiocarcinoma in isolated case reports and sort of small trials at single centers for a long time until 1993, when Mayo Clinic started focusing on doing a more controlled trial for this, specifically for perihilar cholangiocarcinoma. What they discovered is that if you take a patient with a perihilar cholangiocarcinoma, again a cancer where the bile ducts are coming together as they exit the liver, and you treat these patients with both chemotherapy and radiation for 5 weeks, with the goal being of shrinking that tumor, and then performing a liver transplant after that, these patients actually had longer survival, both longer survival overall and longer survival without any sort of recurrence of their disease, the cholangiocarcinoma. This hasn't been studied as formally in the other types of cholangiocarcinoma, in distal and then intrahepatic cholangiocarcinoma. These information here is still sort of limited to isolated case reports. The distal form of cholangiocarcinoma is typically treated still surgically, and the intrahepatic form, there's been some look at the use of liver transplantation, but there's not as much data, essentially. Moving forward, really, the most important things to do in this field are to apply the Mayo Clinic protocol with chemotherapy and radiation to the intrahepatic and distal forms of these cancers and seeing if there's any sort of data-backed utility in performing liver transplant in these patients. But I think it's important to note that, especially in patients with perihilar cholangiocarcinoma, this is an option that has been shown to improve survival and can help these patients live longer, healthier lives after being diagnosed with a very scary and previously almost entirely fatal disease.